I used to teach law enforcement how I used to teach juries. Like I trained my section. I probably am the best meth cook in Arkansas, or I was 10 years ago. But it's not something that very many people can say and it be legal.
Right.
I have a master's degree in chemistry and I worked there, and then eventually I just kept having this gnawing feeling that I was not chasing my dream.
Yeah.
So I went back to school and here I am.
Chasing your dreams.
It's a whole lot more fun.
A lot of people need this,
I love it. I'm very happy with the switch. It took a lot of more work than I would have ever wanted to do. If I'd known what I had to do, I probably wouldn't have done it.
Yeah.
Because I had to go back to college and take classes that I could teach, but I hadn't been in them for 25 years.
Yeah.
And people wanted to make sure I could still handle the curriculum. So I
Right.
had to go take a bunch of stuff. And then I had to go to a graduate program for 28 months. I had to move to Searcy away from my family for a year. And
Oh.
You got to do all that.
I lived up there during the week and drove home on the weekends. And
I was going to get rid of all that fish. Could have just left it in there.
just help.
Listen, on this here, I know I'm going to pack with the packing strip, but I don't need to put like one on top of it, right?
I'm pretty sure that tissue's going to die, but let's give it a chance.
Okay, I'll just pack it and leave it.
Looks pretty dusky. But if we pack it, maybe it'll live. I don't know. Doesn't look like it has a whole lot of blood flow right there. But looking, I think if we do Dakins daily for a week and bring all that stuff back, we want to put that back on next week if we can. Let's just give this a shot.
Okay.
Now, this is a little bit different thing, and I'm talking to my doctor, but I think Dr. David got me hooked up with a PAD because they found there was a blockage.
That's going to be the most important thing. Because even if we have to do something terrible like an amputation, you still have to have better blood flow.
Well, that's what I'm
So you're
trying
talking
to
about
get.
Dr. Gary Allen?
Go ahead with that.
Dr. Gary Allen, is that what we're talking about?
Yeah.
I hope you can go see him.
Yeah.
I want you to go see him. He's a wizard.
Well, that's what.
Hello?
He helped my father-in-law. He's a good guy. He's a really nice guy.
Well,
And it's
yeah.
outpatient.
Yeah.
This is
No, we're in here. They're
where we're having
digging
a little
his
bit of
foot
a
out.
with my
Okay. We're
regular doctor. I'm trying to tell him not to.
They're showing me what
I mean, I need to do this, and he was kind of throwing a little bit of
Okay.
this stuff we've been doing in the lab was kind of a little bit of
okay.
a roadblock, or a little bit. And I kept telling him, this is the worst thing I got. Is how that blockage is. It throbs and then start pain, and that's where I started hitting my heel to start with. I said that's the source of it, and they wanted to maybe move it up a little, and it was like the 26th, and that's why I went there yesterday. And he was kind of saying you need about kidney, and I didn't want to get into a whole bunch of stuff, but I knew this was.
Well, your primary care is worried about your kidneys, and I get it. And Dr. Gary Allen will also worry about your kidneys because he's going to need to give you some dye, but maybe he can do a reduced dose or something that will put less of a hit on your kidneys.
Yeah.
And you just have to make him aware from the beginning, I have kidney issues and I don't want to make my kidneys fail.
Yeah, no,
He knows how to do that. I mean, he's a radiology guy.
I knew
he
he
understands
was
dye.
I knew he was top guy, and I really like because Dr. David. I mean, he's really been. He's a surgeon, so he's been the best getting something done.
Dr. Dean is very discerning about who to use. He's a good guy to ask for advice because he's not going to get his emotions or his personality involved. He knows who are the actual experts of the subject.
Well,
Dr. Allen is one of those guys. He gets down. What we love about him is he's so aggressive. Most of the vascular people want to stop about right here.
Yeah.
We have this trifurcation right here where one vessel becomes three and goes down to each side of your foot and over the top. And Dr. Allen will go past this and down into each one of these smaller arteries and even go down into this pedal loop that goes under and around the foot. It's amazing how low he will go to fix
does he need
those
to tell
blockages.
do you need to tell your primary care doctor about him?
well, I've got that kind of covered now. That after yesterday, because
Okay.
we've done all this lab
Okay.
stuff.
Yeah, I mean,
and-
just let Dr. Allen know that you're having issues with your kidneys.
Yeah, I
Just let him
know.
know what your labs
Yeah.
are.
No, they were great. I went over there and did all this stuff, and I can't believe how good they were over there. They had this guy, Pakistan, what level he is, but he took all our notes and just stood in front of me and summarized everything. It was just amazing how they did it, the whole thing, the people involved. So that's why I wanted to.
It's a good operation. You're right.
Yeah, and when they called me yesterday, there was a possibility of moving it to Friday, and we got in this stuff. You know, I went to the emergency room and all, just so we could kind of clear the bases with my PCP. But I keep getting a little bit of, as I say, a little bit of roadblocks from him, and I'm trying to say, hey, I think we got this covered, and I think
You're not
it's
going
been-
to get anybody better. It's not going to happen sooner.
Right.
It needs to happen now.
Now.
Yeah, I knew that was emergency.
Yeah.
I mean, last night and even today, they'll start throbbing, and I'll get and that's when I start beating my heel in there.
Yeah, we got to get it fixed.
It all kind of tracks back, yeah.
And, okay, the shoe, clean it tonight with, kind of spray some,
Bleach
bleachy
water.
water and let it dry. Put a fan on it, let it dry. And then you're gonna show me what to do every day.
Yes, ma'am. Can we see you in a week?
Sure.
All right.
I've been coming
Y'all have a
to.
good week. Thank you.
Thank you.
Yeah, well, thank you. You were good.
All right, sweet love, you ready? So it's not as bad as it looks, I promise. I'm gonna send you home with a lot of this stuff today, and I may even have to order some of it because you're gonna need something for every day.
Yeah.
So it's Dakin's wet to dry, and we say wet, but we really mean moist. So this wound will require 2 parts. Here on the side, there's a little tiny hole. Take your time, and it will require this little strip here. We're gonna pack this little strip inside that hole, and then this area I'll use like a 4x4 to just put it in there. But first thing first, I'm gonna pour Dakin's on these. So these will already be wet. You shouldn't have to do anything with this but pull it out and cut enough to put in there. And then for that one, the larger wound, take your time. I poured the Dakin's on the gauze and I'm gonna wring it out.
Is that, is the bone showing there?
It's up in there. You can hear it, but you can probably feel it, but you can't just see it exposed because it has that necrotic tissue.
And the
over it.
new, is that on the side, the new?
Mhm. Yeah, that little pinhole is where we're gonna pack that strip into. Yeah, that's the newer one. But with the Dakin's, you pour it on the gauze and you wring it out. You want it moist.
So I've
and
got
not wet.
gauze, and I'm gonna,
You have gauze at home already?
I don't think
I'm gonna
so.
send you with stuff in it.
Yeah. And you're
This will last you. This is for this new area. This is for the pinhole.
that'll last me,
And there's a lot of it in here.
okay.
So let me just get this in here. I'm gonna do this one first, and then I'll do the little pinhole.
Yeah.
So you know, you moisten it with the Dakin's, you wring it out. As long
Uh-huh.
as it's wrung out, you're ready to put it in the wound.
Yeah.
And you kind of just make sure it's fitted in there good.
And that's dry. You just put the gauze in there dry.
Well, I wet this.
Oh, is that already wet?
I wet it and I wring it out.
Okay.
Cause
With
you
this.
with the Dakin's,
Okay.
yes. And he may have to send you a. Do you have the Dakin's at home? You got the bleach solution already, or we need to
Yeah, we
send a
got some.
prescription? You have it, okay.
Yeah, we've been putting that on twice a week.
The Dakin's to
Yeah,
clean it.
but it needs to be every day is what.
Yeah, this will be every day from now on. Well, for a week at least.
Yeah.
Let's see, I'm gonna lift your foot. So you pretty much put your moistened gauze on that, just like that.
Mhm.
And then the next part for this, I'm gonna cover it with those dry gauze.
Okay.
So it's wet to dry. So the next step is that new wound that you'll use these little strips on. I don't know how much you'll need, so I usually just cut off a great deal amount of it.
Mhm.
And then I don't want it soaking wet, so I wring it out.
Right.
Always wring it out.
And you're send me gloves.
I'll send you with some gloves, yes ma'am. And then like I said, I'm gonna try to order the same stuff to come to the house.
Yeah.
So with this little bitty one on the side, it's gonna require you to use this cotton tip applicator to guide it in there. And you don't force this in there. You just gently guide the gauze inside. As you want to fill in that space.
You want to use this camera to take a picture of what she's doing? Hey.
When will the nurse be back out?
She's scheduled for Thursday.
Okay, I know there's
But
weather.
the weather, yeah.
Yeah.
Yeah, well,
So I'll need to do this tomorrow.
Yes, today is okay, but tomorrow, yes.
Okay.
And you just kind of want to guide it in there until you meet resistance.
Until what?
You meet resistance till you can no longer get any in there. And I cut off way too much.
Yeah.
I mean, she didn't come Monday, but she might come tomorrow. I mean, I'll see.
Hopefully, if they can get out there.
In the morning, maybe, or something.
Well,
See, I can't get any more in there,
Okay.
so I'll stop. And then the next, I'm
And
just
I'm gonna
gonna.
have some of those things too.
Yes, I'm gonna send you with that as well. Yes, ma'am. And then I'm just gonna cover both areas with some dry gauze.
Uh-huh.
You always cut this to where you leave a tip. Just leave a little bit hanging out. Just like that. Then I'm gonna cover it with dry gauze and roll gauze. And that's it. I'm gonna try to send you with a bunch of stuff too.
Okay.
The same stuff I'm using here today.
Yeah.
I think there might be a little confusion on the nurse coming out was, I think Paula sent some instructions about drawing blood because of.
Yeah, she said she canceled that though because she sent you for a whole new antibiotic. So
Okay.
they shouldn't have to do any
Okay,
to check
well,
your digoxin levels.
Yeah, because they were. That's the reason they didn't come Monday, and that's why I said they might even come Wednesday, Thursday, just to kind of get this going. But it doesn't matter. I mean, we're going to have to do it anyway.
Okay. And then now I got the dry dressing on there. Just gonna wrap it all up. Okay. And the end. That's it. Don't be discouraged. It's gonna be okay. I know. It's no fun. It's only for a week. And Dakin's Wet to Dry is the best. If you got any kind of wound and you don't have anything else to put on there, you can never go wrong with this right here. Ever. That'll help that smell. It'll help it kind
The
of
smell
reset.
and everything.
Yeah, it helps a lot. That's why we stop in that bag. It'll
Wow.
make all the difference.
Yeah, that was a real expensive thing too. Whatever the salve was.
Oh yeah, you had Santal.
Yeah, Santal. Yeah.
And Santal does what Chris just did. That scraping he does with that
Yeah.
green thing, that's what Santal does chemically. And it activates it when you do this type of dressing. The wet to dry. The Dakin's Wet to Dry.
And then you started at the top. And then you, right?
Yeah, I kind of just started here around the toe, and I
Okay.
gently wrap the whole foot. It don't have to be perfect or pretty, but long as it stays on for 24 hours, it's okay. It's all about just keeping your gauze in place, really. And I'm also going to give you what's called Tubi Grip. It's like a compression stocking, but it's not as hard to put on as a regular compression stocking. Just to help with some of this swelling in your leg. You just pretty much wrap it on there to hold it in place.
And you have to tape it.
I'll tape it once I get to the end. Yes, ma'am.
Is that cut in rolls that it needs to be to go in?
Yeah.
Okay.
Yep.
It's cut. One of these needs to go,
I use the whole thing.
the whole thing.
Mm-hmm. And you know, you'll get the feel of it. You kind of got to do what works for you. But that's pretty much the method. And it's all covered up. Now I'll tape it.
Okay.
And I'm going to get you, like I said, I'm going to get you some stuff together. Only thing you won't have to wet is the strips, cause I've already poured the Dakins on these.
And so that'll be for a week.
I'm gonna do this for a week.
Okay.
The
I mean,
wet to
what,
dry.
I don't have to add any of those for a week. You think that's enough for a week at home?
Oh yeah, this will be plenty because I didn't have to use a lot in there.
There.
So yeah, this will last you for sure. I'll even send you with another bottle. You may have to, you'll wet it yourself, but I'll send you with another.
Okay.
I got some stuff. I'm gonna get you some stuff today. And like I said, I'll order the same
And that
stuff.
was, what was that
This
for?
is the Dakins.
And where did you put that?
We poured it on the 4x4, and then I wranged it out.
Yeah,
It's your
And
wet.
we got one of those. I
So
don't
you have
have.
the Dakins good.
okay.
And we can get it at the drugstore.
And then ring
Yeah,
it out.
yep. I poured it on one of these. I squeezed it, and I put it on the hole in the heel.
Okay.
Okay? I'll send you with plenty of stuff today. And that's used, the wet, and then you cover it with the dry. And then
Yeah.
you wrap it up.
The wet to dry.
Wet to dry. Yep, that's it. That's why I say if one of the nurses could come out, that would be perfect. But you can do this. It's fine. It's just a little process. You got it. Don't be discouraged. I see the look on your face. But just once a day. It's fine. I'm just gonna get some Tubi Grip on you, the compression stocking, and then I'm gonna get y'all some stuff packed.
Do we leave that on?
This can actually stay on. He should put it on in the daytime. When
Yeah.
he gets dressed, take it off right before bed.
You hear that, Herb?
Yeah.
Okay? Just take it off before you go to bed.
I'm,
Put it back
I'm
on.
videoing, so I've got to hear
No,
it.
that's
Look at.
fine. Put it back on 30 minutes, like after you wake up in the morning. Just don't
Okay.
sleep with it. And it's easy to get on. After you do the dressing, you could just put it on over the leg. It's a little
Leave it
precious
all
sleeve.
day.
Yep, you can keep this on all day long. Yes, ma'am. Let's see. Let me get it all taped up. I'm gonna send you with some tape too.
Okay.
I think what I'm sending you with may be enough, but I may go ahead and order some stuff.
Okay.
Well, actually, you have home health, so they will have to order you. So today, I'm gonna make sure I send you with 7 days worth
Right.
to do this dressing.
Yeah.
Okay.
Because they may not can get there with the weather.
Right, exactly. I'm gonna send you with 7 days worth.
Okay.
Okay. Make sure you got what you need for this 7 days. We're gonna do this dressing.
Mhm.
That way we don't have to worry.
You want to go home with me and stay?
Oh, you're gonna do just fine. I promise you. Especially after it's all about that hands-on. Do you want to try hands-on right now before you get out of here?
No.
You sure?
Okay.
You want to? Because I'll take all this off and we're going to let you start fresh from the beginning.
No, I should have videoed it like he said. We should have videoed it. But we
Well,
didn't.
he did too.
I did.
Oh,
he
you
did.
videoed her what she did and everything?
Well, yeah.
And then
yeah.
I discussed it too, so
Yeah,
Okay.
I think
we
you'll
got-
be
we
fine.
got
Yeah.
good
But
video.
anytime you feel discouraged, like, I don't mind letting you do it yourself. Because there's nothing like hands-on.
Okay.
Yeah.
All right, let me get this on and get y'all out of here. Like I said, I'm going to send you with enough stuff. Enough of this dressing to do it for 7 days.
So will I need to put that on there for him?
Possibly. He may need help getting it on. It's just a compression sleeve.
Okay.
It's easy to get on, though. And I'll send you with a few of these.
And he takes that off at night?
Yes, take it off at bedtime. Don't sleep in it. And put it back on in the daytime when you get dressed.
What about when he goes to the bathroom at night? Does he put it on?
No. He doesn't have to have it on to go to the restroom.
But he's supposed to wear his shoe?
Well, the
when
shoe,
he does
yes,
that?
but not the stocking.
Okay.
The shoe is to keep pressure off that heel.
Yeah.
I'm gonna put a few of these.
Anytime he's up, he has the shoe on.
That's
Like if
good.
you're at your desk, Herb, you have that shoe on. You don't have it off, right?
I put it on all the time.
Yeah.
I mean, even when I lay down on the bed during the day, I'll have it on because I may get up.
Yeah, when you get up, you can have it on. I'm just cutting.
I keep it on pretty much all the time.
Huh?
Scissors are
I keep it
awful.
on all the time.
And then, like, if you're just laying in the bed, like, even at bedtime, if you have a pillow, if you just kind of put it under this area here, it makes it where this is like floating. There's no pressure on the heel. It's kind of
Yeah.
just up in the air. So let me let this chair down. It's taller than me.
And you got some of those cut, or do I cut them? For,
What was that? Oh,
did it
the
do
Walker?
this? Walker?
Oh yeah. Oh my God, that scared me to death. I was like, what is that noise? Okay, yeah, let's get you out the way, huh? Right. Yeah, everything I used today, I'm gonna make sure you got enough for 7 days.
Okay.
Okay, so no worries.
Yeah, that
Because we
noise.
usually can order stuff, but if you have home health, they order it. But we're not gonna worry about home health. I'm gonna make sure you have stuff, especially with this weather getting nasty.
Yeah.
They may not make it out there.
Have you called Home Health Herb to
Well, I'll
put an
call.
order in to know that they're
Well,
supposed to?
we've been talking. And
What home health agency is it?
it's UMS.
UAMS Home Health. Okay. I was gonna say when Chris update the orders today, I'll send them a copy.
Yeah.
So
Yeah, I
this
mean,
is
I'll call their number and tell them what's going. But because they had a schedule going for the,
how many
Thursday.
how often they come out.
but they usually come twice a week, and they didn't come the first time because there was a lot of confusion, like you know about the.
The vac and the labs.
Well, yeah, taking the. Because last week we were talking about taking, because of the medication.
So with this, it just fits at the base of the toes,
Yeah.
and then just up the leg, below the knee. That's it.
Okay. And then the shoe goes on now?
Yeah, I'm on. You said that shoe's wet.
Well, it smells. Is it wet, kinda?
Let's see.
Mhm.
I was gonna say if it's wet, I'm gonna put a little blue booty on your foot.
Yeah, I think y'all do
It's
that.
not wet. It's
Okay.
not wet.
Just stinks.
I guess it just has a little odor, but it's not wet. Do you
Okay.
want a blue booty on? Or
Yeah, we've been.
Oh, you
doing
got a
it.
sock.
I don't know. I'll do the socks for her, but with
You
that
want the
leak-
sock back on?
Yeah, unless you want to put the blue.
I can do both. It's cold out there.
That'd be fine. Put that, then have that blue.
Yeah, I can put the blue booty on too.
That way it'll have a.
Just a little
It
extra
really kind of
protection.
needs the socks for the shoe because it has to have something in there. But you have a lot more stuff on there today than we normally have because we hadn't had it with the pump.
Let's see, look, I'm gonna just slide in this drawer. I'm sorry.
I'm sorry.
No. I want you to take your time. Be
my
careful.
balance is bad.
No, I want you to be extra careful. And then I'm gonna just get you some stuff together, okay?
Yeah.
But yeah, I think this Dakins is the best bet instead of putting that vac back on her. So maybe next week we can get the vac back on her.
Yeah.
Start over. Does that feel okay?
Yeah, that feels good.
Okay.